Good afternoon and welcome. I am Mark Cloutier, CEO of Caminar in our Family and Children's Services of Silicon Valley Division. Thank you so much for adapting to these changing times and joining us online to talk about adolescent mental health and evidence-based strategies to help our youth both now and beyond this current public health emergency. This virtual event is a celebration of our annual Circle of Support luncheon that we host in the San Francisco Bay Area. This event has a long history of bringing together people with a shared commitment to the health and well-being of our community, raising essential funds for our programs, and aiming to reduce stigma around behavioral health topics through education and conversation. The silver lining in changing this event from an in-person luncheon to a virtual conversation is that everyone can join. To that end, I am so happy to welcome so many new people to this event. And I extend a very sincere thank you to all who have been supporting our organization over the many years of the Circle of Support tradition. To those of you who are friends of our former beloved board member, Barb Jones, who passed away this last year, thank you for joining us. We remain committed to honoring Barb's legacy in a format befitting her leadership and generosity. We plan to present the Barbara E. Jones Award for Community Leadership at our In Concert with Caminar event in October. You will all be invited and more details will follow. Before we go further, I want to express my sincerest gratitude to our event underwriters. Each of our underwriters committed their resources well before coronavirus changed our plans and lives. We are humbled that they all stood by us as we shifted to this virtual event, and we are so grateful for their ongoing support of our work and our clients. We are truly honored by El Camino Health's presenting sponsorship and their unwavering and generous support of Caminar. Please join me in thanking all of our sponsors, Terry Bullock, Janie and William Kint, Hanson Crawford Crum, Barbara Patterson and Dr. Andrew Menkes, the San Francisco 49ers, Sutter Health Mills Peninsula Medical Center, SciMed, Boston Private Bank, Fremont Hospital, Stanford Healthcare, and Punch Magazine. Thank you to all our event co-chairs, Caminar Board President Betsy Pace and Board Vice President Barbara Patterson. We couldn't have done this without you. Finally, a very special thanks to you, the Friends of Caminar, and our Family and Children's Services of Silicon Valley Division, who generously made personal underwriting gifts. Thank you. You'll see all the names of all the amazing event contributors in our digital program book, which is linked to the description of this event on YouTube. Let me briefly tell you who we are. Caminar and our divisions provide life-changing behavioral health care to individuals and families in the San Francisco Bay Area. Throughout the year, we are here for individuals and families during some of the most challenging times of their lives, times when hope feels distant and out of reach. A child may be acting up at school because of a traumatic event at home. A mother may be losing sleep, worrying that her teenage daughter will act on suicidal feelings. An adult may have lost everything to mental illness or addiction, or both, and sees no way forward. We combine compassion, science, and the understanding of root causes to treat and care for complex mental health, substance use, and co-occurring needs in our clients, with the ultimate goal of creating lasting individual and community health improvement. And we have quickly evolved our practices and protocols to ensure we continue to provide these essential services to our clients during these uncertain times through telehealth as well as in-person services. We come together today in a time when we need each other like never before. While we are facing an infectious disease outbreak, it is crucial that we acknowledge and address the co-occurring mental health and substance use epidemic that predictably follows in its path. Our ability to ultimately manage, control, and end this epidemic will be primarily driven by our individual and collective mental health. I mean longer-term ability to manage the feelings associated with loss, uncertainty, risk, and an unpredictable future. Observing shelter-in-place orders puts us at odds with our best instincts. We cherish our freedom of movement, visiting friends and family, attending sporting events or artistic performances. Many of us are going a bit stir-crazy, and some of us have found a peace and solace in the silence. Like you, I suspect, I'm a bit of both on most days, with lots of layers of feeling in between. Personally, I'm finding it hard to concentrate at times, and I live for the day when I can go swimming again. We know that mental health and substance use disorders increase substantially following, during, and peak at 1 year after a natural disaster. Similarly, increased substance use and mental health disorders are prevalent during and following a quarantine period. As well, a COVID-19 infection, death of family or friends, effects on community life, and the economic effects further amplify feelings of anxiety, depression, numbness, anger, guilt, loneliness, fear, helplessness, and sadness. If left untreated, a large proportion of people go on to have these symptoms for the rest of their lives in the form of anxiety disorders, depression, and addiction to drugs and alcohol. The behavioral health response to all of this needs to be robust, targeted, and based in science and compassion. We at Caminar had a head start on building a crisis response, as we had just completed our strategic plan to become the best provider of mental health and substance use treatment in our community. More on those details for another day. The key message is this: Caminar is positioned to tackle this growing need for mental health and behavioral health care in our community. We are here for the most vulnerable among us, and we appreciate your support of our organization and our mission. I'd like to turn now to introducing Dr. Jess Shatkin. Jess, who is joining us from his office in New York City, where he is sheltering in place. Jess is a nationally recognized child and adolescent psychiatrist and educator. He's a professor of child and adolescent psychiatry and pediatrics at the New York University of Langone School of Medicine. He leads the educational efforts of the Child Study Center at Hassenfield Children's Hospital at NYU Langone. He developed and continues to direct one of the nation's largest undergraduate college programs in child and adolescent mental health studies at NYU. And he's authored numerous publications throughout his career, including his most recent book, Born to be Wild: Why Teens Take Risks and How We Can Help Keep Them Safe. Jess is going to talk about how isolation, quarantine, and social separation from peers affects children and adolescents, and he will then go on to how we all can help foster mental wellness and healthy development in children and adolescents in the coming months. Please join me in welcoming Dr. Jess Shatkin.
Thank you very much, Mark, for that very kind introduction, and I'm very excited to speak with everyone here and to be presenting at Caminar, such a wonderful organization and such a wonderful group of supporters. So let me pull up my slides here. The title of my talk hasn't changed, but about a year ago when Mark asked me to speak with you at this meeting today, we talked about speaking around health promotion because there's so much that we can do to prevent mental illness and to identify it early and treat it early so that it doesn't get out of hand. So my title hasn't changed, Mental Health Promotion and Disease Prevention, It's About Time. But I'm going to add, as Mark said, some information about COVID because it's so consistent with the main message of what I've been what I was planning to speak with you about. And furthermore, of course, we're at a once-in-a-century moment when we have an epidemic that has taken us by surprise in most regards and has left us with having to scramble. So these are my disclosures. The book Mark mentioned is Born to be Wild. The less sort of parenting more academic book is a practical guide used by trainees throughout the country to learn child and adolescent mental health and psychiatric care. And then I have a radio on Channel 110, Dr. Radio, Sirius XM, every Friday morning, 8 to 10, which I've been doing for about 13 years. Now, I don't usually dedicate lectures, and this isn't something that I've done a lot of in my life, but I did want to say something about Fred Mayer. Maybe some of you know him, being in the Bay Area. I grew up in San Rafael, and Fred raised his family 5 houses from mine. And one of his sons, his middle son, Charles, is my best friend and is a family practitioner. When we were in 5th grade, Charles and I pledged to be doctors, and we did become doctors, each of us. He's a family doc, as I say, in Seattle. And Fred had a major influence on both of us and on so many people in the community. He ran the Rexall Pharmacy on Bridgeway in Sausalito on the main drag there. And here's a picture in the corner you can see of my wife and I and Fred and Jackie. Fred started the Great American Smokeout with the American Lung Association. Fred started one of the main movers behind getting safety caps on pills. Fred was constantly presenting to various city councils and boards and suing the state of California dozens and dozens of times to improve health practices for people in the state of California. He developed Pharmacist Planning Services Incorporated, which reached out to hundreds of pharmacists throughout the country and kept them apprised of public health interventions. And one of my favorite things that he did was to promote condoms. And he started the National Condom Day and then Condom Week. And he had these pregnant man posters. And you can see Andre DeShields, a Tony-winning actor, who was modeling for him here in the corner. How would you feel if it were you who got pregnant? And those same concerns are true today. So Fred helped to steer me into public health. We're going to talk mostly about prevention today. And I want to thank Fred for that. And he passed away in December of this last year. And I was all things considered, happy to be at his passing. So let's talk COVID to start. That's where we're going to go to begin. And then we're going to talk about the mental health problems faced by our children, which I know you know, but I'll give you some numbers that might be helpful for you to think about and may be impressive for you. We'll talk then about the challenges to delivering adequate mental health care to children and adolescents. We'll talk about how health promotion and disease prevention differs from business as usual. We'll talk about the practices that help prevent mental illness and enhance our children's resilience. And I'll spend some time talking about that. And finally, we'll talk about next steps as really a summary of the things that we can all be doing today and tomorrow that will make a difference. So first of all, COVID has taken us by surprise. And this is one of the many good memes that I've seen, and I'm sure you've seen many as well. What does COVID really mean to our children and to ourselves as parents? So here are some of the challenges that occur to me. Kids, some of them, are fearful of getting sick and dying. They're fearful, more of them probably, that their family members will get sick or die. Kids are very sensitive to routine. And the more difficulties a child has, whether that's medical illness or psychiatric illness, the more upset they will be by a change in routine. They may be disappointed about not attending various school and extracurricular activities. They may be happy about not attending some of them. They will get bored and restless. And this is an area that I think we have a great opportunity for enhancing resilience, because we've kind of not let our kids get as bored as they used to. And that's unfortunate, because being bored is kind of a good thing. It teaches you resilience, but more on that later. Lack of physical activity is a concern. Lack of support services, since many of our kids get their support at school. In fact, even though we have a paucity of mental health care available to kids, most kids get it at school in this country. And with schools shut, they're not getting it. Also physical therapy, occupational therapy, learning support, and so forth. One of the funniest memes I saw recently was a parent standing in a corner by themselves, and someone says, "Excuse me," and the parent says, "Shh, I'm having a parent-teacher conference," because they're talking to themselves. So parents are now teachers in a way that they weren't before. So parents are concerned about keeping everyone in the family healthy and safe. They undoubtedly have financial concerns. They're managing remote learning and being that parent and teacher. They're dealing with loss themselves, managing behavior and discipline 24/7, where they used to have some time in the day when the school and peers enforced some of this. Managing anxiety, helping children with special needs, and managing teens and young adult children. So I've got a few pictures just to orient us to some of these concerns and to give us, I think, a few tips and pointers that I hope will be helpful for you. So supporting ourselves. First, we always say this with parents, and I say this a lot on my radio show on Sirius XM. First, put on your own oxygen mask. We really are not very much good to our kids if we're not at least first addressing ourselves. And the first thing is to get dressed. And I know you think that I'm talking metaphorically now. But I'm actually talking about getting dressed. I think it's really easy when we're at home to be in our pajamas all day, to not put on a work shirt, to not get ourselves out of bed at a regular time. And we are our children's greatest role models. So if we don't role model the behavior we want to see them engage in, they're not going to get there. So we got to get dressed and we got to get going, and we've got to manage our own anxiety. And there's lots of ways this comes out, but one of the most common in a situation like this is the catastrophic thinking. Oh my God, what if? One thing could lead to another. We'll lose money, be out on the street, whatever. And we have to guard against that. We have to limit our own social media and news consumption because there's so much there. And I find myself watching the news at night and I can get stuck, as I have many times over the last few years. And it just brings you more and more down and makes you feel more and more hopeless and powerless. Stay in touch with family and friends virtually. We've been doing cocktail parties with Zoom. I'm sure you've been doing something like the same. Still try and make plans for yourself. Still look to the future. Looking to the future is a very hopeful activity. And although you want to be in the moment and be centered, and that's another lesson, we also want to be anticipating some nice things down the road. So new hikes if you're out in the woods. Listen to different music. I was listening to Fiona Apple's new album, which got great reviews. And although it wasn't for me, I still listen to it. I want to expose myself to new stuff, start a new TV series, have family game nights, the kinds of things that can bring you together and engage you. This is number 6 here, and I'll talk about this more when I talk about resilience. One of the most effective things that we can do, exercise, sleep, and nutrition, which are the basics, are so important. And it's because many of these things have slipped in our country. It's in part, at least because of that we're having such a slip in resilience amongst some of our kids and adults these days. More on that soon. We need to expect some regression. Some of our kids are going to have trouble, and we will too. And we need to be okay with once in a while waking up late and once in a while getting more angry than we would normally get and losing a little bit of our cool sometimes. We need to ask for help and accept it if we need it. So all those services that Mark was just talking about, Caminar is open and ready for business. We at NYU and Bellevue, we're open and ready for business. And so we are anticipating and embracing all the folks who still need to be seen. And it's readily available. Inpatient if it has to happen, emergency room if it has to happen, in the hospital if it has to happen, but also clinic. We've gone totally remote, and we're almost seeing as many cases remotely as we were live face-to-face, just by a few hundred off per month actually at NYU, and we see about 50,000 visits a year at our clinic. Once we have our own masks on, let's put on our kids' masks. So keep routines in place to the degree that you can. Again, getting dressed, having meals at a certain time, maintaining a bedtime, maintaining activity times so that when there's extracurriculars, they're actually engaging in something extracurricular. Making plans for the near future, just like with the parents, cooking meals, playing games. One of the things that we've gone away from in schools in recent years is things like home ec. I took a year of home ec. I took a semester of typing. Those things had a huge impact on my life. I'm a really good typer because I took a typing class, and I know how to cook. At least it got me started from taking my home ec class. And I was a much better suturer in medical school because I learned to sew in home ec. These things are important, and parents can do a lot of this now that the kids are home. Help them find fun ways to stay in touch with their friends. You got a role model, as I said before, and try to keep it positive if you can. And when you talk to your kids about COVID, like when you talk to them about anything, it's not just one conversation. It's going to be an ongoing conversation. And you want to start with where they're at. Meet them where they are. What do they know? What do they want to know? So you don't give them unlimited exposure to the media because that's overwhelming. And you don't just drop the bomb on them and say, oh my God, now there's anticoagulation problems. Instead, what you do is you say, so how you doing with this COVID thing? What's going on? And that may be how you talk to an 11-year-old. And a 15-year-old, you may say something different. You may say that, or you may say, hey, how you doing? Are you worried? Are you concerned about anything? Let's talk about it a little bit. Let's touch base. And with a little child, you may say, everybody's staying home. You've noticed, this is so different. What do you think's going on? How's it going for you? What's happening? However it is that's natural for you to approach your kids at different ages, you want to check in with them and see where they're at. Stay in communication. As I said, this isn't just one conversation. And our kids, we got to air them out. They do need exercise. They really do need to move. That helps a lot. There's so much richness in the data that's making me say, give them exercise. But we know that the body is often an expression of what the mind is feeling. And our emotions have such a huge impact on our physical being. So if we're feeling stress and we exercise our body, that stress goes down. This is the same reason, ironically, that kids who engage in self-injury, cutting or harming themselves, do so because the emotional pain is too great, and there's only one set of brain receptors that deal with pain, and the same ones that deal with emotional pain deal with physical pain. So if you lessen that emotional pain by doing something physical, it often makes you feel better. That's not healthy for people, but it's what people often do. Likewise with exercise, if we're feeling wrought up and stressed and wiped out internally and completely overwhelmed, when we exercise, do push-ups, take a run, get outside and hike, that's going to bring down some of that cortisol and epinephrine that's making us feel so tense. And sometimes it's okay to choose your battles. We don't want our kids watching TV all day long, and God knows they get plenty of screen time. But if you have a meeting you have to attend online, or you have something you need to do that's shopping and doesn't involve them, and you need to plop them in front of the TV for an hour or two, choose your battles. When my kids are young, my wife and I used to joke, sometimes when we'd give them some extra TV, we'd say, okay, you can watch TV, but don't do drugs. You choose your battles sometimes. And help them learn to tolerate uncertainty. And there are a multitude of opportunities here. Our kids are in a world now that's uncertain. And one of the major things that drives anxiety is uncertainty. So use this as an opportunity. How can we think about this? And I'll give you a lot of tools as we move forward. And now for the real challenge, right? Supporting our teens and young adults who can be very difficult and give us a hard time. And this is the favorite meme that I've seen in the corner here that I've come across so far since I've been in this COVID era. We want to stay close, we want to be connected, and yet at the same time, we recognize social distancing has to happen. So help them manage that. That's a really difficult thing because everything about evolution is driving our kids towards being together. And of course, they're going to want to break the rules and spend time together. Help them structure their days. That's one way you'll help them manage physical distancing. My son now, who's 19, he's taking a gap year. And so one of the things that we've been doing is getting him more involved in activities. We're taking guitar lessons. We're doing German online. We're taking a class together in German. I actually play guitar, but I'm not teaching him because that always runs into conflict. So he's doing that on his own. He's reading books. He's picking up books. He's doing some writing and, of course, exercising and spending time with the dog and all these kinds of things. This isn't how we thought he was going to spend the last half of his gap year. So structure is important. Help them with remote schooling. And that is an important aspect. They're going to need your attention there, staying up on assignments, supporting them as a tutor. Empathize with their losses. They've had some major losses. My daughter's a senior in college, and she's not going to get a graduation. And will she go back next year when they promise to do it? We'll see. Prom for the high school kids, or the Christmas formal, not seeing friends, all of those things are major losses. And we may think of them as trivial because we know that in the big picture they are trivial, or many of them are trivial, but to our kids, they're not trivial. Again, coupling, connecting is the most important thing they're doing at this point in their lives. And so we need to understand that and remember how important that is and validate their disappointment. This sucks. It really does suck. And don't try to fix it for them right away. One of the biggest reasons that kids express frustration, and I do a lot of psychotherapy with adolescents and young adults, and one of the biggest things that they say when they talk to me about their frustrations at home is, my parents don't listen to me. And their parents do listen to them, but what happens is their parents get anxious when they hear their kids in distress, and they want to fix it for them right away. So they jump in with, yeah, I know, but, well, I get you, but you can also, and that feels invalidating to our kids. So before we fix it, we might want to ask them if they want us to help them fix it. But even before that, we want to let them spew a little bit and let them tell us how much trouble they're having. Encourage the healthy habits, more on that soon. I touched on that already. And we may focus on gratitude and mindfulness because even in this terrible time, there is, of course, so much to be thankful for and so many ways to approach this mindfully. And now I better move forward with what I was going to talk about before. So I hope that was a helpful start to think about how to work with your kids at home during COVID and how to help enhance their resilience. And now I'm going to spend about a half an hour talking with you about prevention and mental illness within our kids. So what are the mental health problems faced by our children? If we were face to face, I'd do a lot of Q&A and discussion with you, and I'd want to hear what everybody has to say. But I very much want to hear from you about, I would want to hear from you about what the problems are. But I think we all agree what the problems probably are. In 1999, the Surgeon General surprised much of America. The Surgeon General writes a report about every year on some health concern. And for the first time in 1999, the Surgeon General wrote a report about mental health. And they said that about 20% of children under the age of 18 will at some point meet DSM, as the Diagnostic and Statistical Manual of the American Psychiatric Association, that children, about 20% of them, will meet criteria for a psychiatric disorder by the time they hit their 18th birthday. And that was pretty shocking. And then we did better studies and found that actually, even in the teen years alone, that's more like about 50%. And the best study we have from 2010 looks at a nationally weighted sample and shows that amongst 13 to 18 years of age, about half of kids will meet criteria for a psychiatric disorder, and about half of them, so about a quarter of the population, 27.6%, will meet criteria for a severe disorder. That's major depression, that's severe OCD, that's post-traumatic stress disorder, that's schizophrenia, that's bipolar disorder, major disorders that are impairing our kids' ability to function. And another important statistic that now we've known for 15 years is that most chronic mental illness that occurs happens first in kids. 50% sets on by the age of 14 and 75% by the age of 24. And that's a statistic that I want every psychiatrist and every healthcare worker, every mental health care worker to have emblazoned somewhere on their body, because we can't forget that. This means that anytime you're dealing with an adult, you're dealing with problems that most often started when they were a child. And it takes about 9 years on average for those kids to get help for the problems they're having. So we have a lot of work to do. And I always say every adult trained psychiatrist is an incompletely trained psychiatrist, because if you don't understand kids, you miss a lot and you don't understand a lot of mental illness. So you've probably heard of ACEs, many of you, adverse childhood experiences. And these are also things that contribute to the mental illness or the stresses and emotional difficulties that our kids are having. These are adverse childhood experiences that we now know affect 2/3 of all kids. These are things, about a dozen factors, the most mild of which most of the time is divorce. But of course, divorce can be very traumatic for some kids. But this is incarceration, a family member who is abusing or abused physically, emotionally, or sexually, mental illness that is untreated or not treated well, drug abuse in the home, that kind of thing. And ACEs increase the risk of everything bad, both physical and mental illness. So substance use disorders, mental illness, smoking, obesity, sexually transmitted infections, all of these are leading causes of death for adults, and more on that in a moment. And we think that ACEs account for about 1/2 to 2/3 the risk of these factors. So more ACEs basically means more trouble. And if you've gone to a primary care doctor in the past couple of years, it's possible that primary care doctor said to you, did your parents get divorced when you were a child? Or anyone in your family ever been incarcerated? Or what kind of a neighborhood do you live in? How much crime is there? Because these things we now know predict how the health of an adult will be going forward. So that the more that we are exposed to these things, the more we can anticipate hypertension, obesity, diabetes, depression, and those things affect us greatly. So in Vince Folletti, who did a study for Kaiser surveying 17,000 adults initially, he found that over 20% of the 17,000 adults surveyed had 3 or more ACEs. And he found that if you had 4 ACEs, if you had 4 of these components, of these stressors as a child, your incidence of chronic lung disease went up by almost 400%. Your likelihood of hepatitis went up by 240%. Your incidence of depression went up by 460%. And your likelihood of making a suicide attempt went up by 1,220%. And we have lots and lots of data now showing many other related similar concerns. Now, amongst young people, 15 to 24, and in fact, this same percentage or the same order, accident, suicide, and homicide, which are the leading 3 causes of death for kids 15 to 24, goes all the way till age 35. So the numbers are broken up typically statistically by different age ranges, but this pattern of accident, suicide, and homicide holds true. Now, I show you statistics here from 2013 because this is the first year that suicide surpassed homicide as the second leading cause of death, where it has remained ever since over the past 7 years. And what you notice about the 3 most leading causes of death, which combined cause about 85% of the deaths, much more than the next 7 most leading common causes, which comprise about 14%. These 85% of deaths amongst children and adolescents are driven by emotions and thinking, resulting in behavior that causes an accident, many, almost half of which are due to drunk driving, suicide, or homicide, so commonly which occur in the context of substance abuse or a mood disorder. And so what we have here is a scenario where our changing thinking and our changing emotions in adolescence leads to new behavior that results in our demise in adolescence. And if you look worldwide, and that's what this graph is trying to show you, most of the leading causes of death, psychiatric concerns as well, set on early. And that's just showing you worldwide data from the WHO. that leading causes of disability, leading causes of death, the burden of those things has been increasing, and it starts early in life. And we've known since 2008 now that worldwide depression is the leading cause of disability. Now, if you look at substance use and abuse, you see this pattern, this kind of graph, where there's little before 12 years of age, and there's little new onset after 26 years of age. But the peak of starting to use drugs happens around mid-teen, late-teen, early adult years. That's when it rises. And it rises predictably in every single society ever studied. As soon as kids hit teenage years and things become more accessible to them, they start to use substances. And thankfully, although most do not become dependent on these substances or addicted, in fact, this is when it starts virtually always. If you're 26 and you haven't smoked marijuana or gotten drunk, there's almost no chance you ever will. That all starts much earlier. And if you look at causes of death and preventable causes of death, then what you see is that well over 1 million causes of death are driven by the behaviors that ACEs often predict, those adverse childhood experiences, but that also people fall into for other reasons, like poverty. Smoking kills almost 500,000 people in America every year. High blood pressure, obesity, physical inactivity, high blood glucose or diabetes, alcohol abuse. Basically, it's diet and it's exercise and it's smoking and it's alcohol. These are the kinds of things that take our lives prematurely in the United States and in most countries. In some cases, accidents might be a little bit higher, or infectious disease might be a little bit higher in the developing country. But by and large, in Western countries, even in cross-culturally in Western countries, we see smoking being the major killer, diet and alcohol being the other two. So these are the things we're trying to prevent. Poverty is a major concern as well. And poverty, the more time you spend in poverty, the more likely you are to experience levels of stress, which the body experiences as rushes of cortisol and epinephrine at higher levels than others. And 1 in 5 children in the US exist below the poverty line. And by the time these kids in poverty start school, they score a half to a full standard deviation below on standardized academic tests. Amygdala, which is a component of the brain that senses threat. It also helps us read emotions. And what we find is that it's inversely correlated with the parent's education. So if you have more of an education, your children tend to have a smaller threat hub in the brain. They tend to have less fight, flight, stress, or toxic stress. And that's important. And similarly, the hippocampus, which is a part of the brain that codes memory, and that helps us to understand something about emotions and code experiences and remember the things that are helpful and harmful to us. That's bigger with a higher family income. If we had time, I'd show you pictures of how these things vary on graphs, but the take-home point is that the brain is affected by the environment in which we grow up in, and affected forever. And growing up in poverty is associated with your brain taking more time to form itself, essentially, and that's a problem as well. So what are the challenges to delivering adequate mental health care? So we know these mental illnesses exist in kids. We know that the preponderance is very high. We know that mental illness and trauma drive a whole lot of difficulties that our kids have. And why don't we just treat them all? What's the problem? Let's just treat them. Well, we have some service delivery challenges. First, we don't have enough practitioners, and that's psychiatrists, psychologists, social workers, everybody who works in the field. There's a lot of inequity in the kind of care that our children receive, and unfortunately and shockingly, most of the mental health care that our kids receive is not known to be helpful. So let me break that down for you. This is a map from 2015, the last time the American Academy of Child and Adolescent Psychiatry did a map looking at how many child psychiatrists there are. Now, psychiatrists, like other physicians, are watched closely and monitored. Not all other type of healthcare and mental health care providers are looked at as closely in terms of how many are where in the country. But physicians are looked at very closely since we pay so much money to train physicians. And what you can see is that in the United States, only Washington, D.C. has an adequate number by estimate of how many child psychiatrists we need. Otherwise, most of the country is red, that severe shortage. Some of the country is in high shortage. The estimated amount is supposed to be about 47 child psychiatrists per 100,000. Who receives care? Well, there's inequity here too. About 1 in 3 symptomatic white kids, about 1 in 5 symptomatic black kids, and about 1 in 7 symptomatic Latinx kids receive care. So there's a huge inequity, and there's lots of reasons for that. It's access, it's understanding, it's the kind of services available, it's documentation of workers. There's all sorts of reasons, but most of this healthcare should happen at school because that's where our kids work. And very few of the 95,000 public schools in the U.S. have comprehensive mental health care services, and the population of children is only growing, and it's growing and growing and growing, as you know. And we need more services, and we're actually getting fewer. And what kind of services do they get? Well, we've got about 23 million children in the US with a severe diagnosable learning or psychiatric disorder. Only about 1/3 of these kids get any care at all. So about 7 million, 8 million. And fewer than 20% of those who have a substance use disorder, an eating disorder, or an anxiety disorder receive any care. So the numbers are even lower if you have those three disorders. And only 2% receive a treatment known to be effective, an evidence-based treatment. Let that fall over you for a moment. Only 2% of the kids who are getting care are getting an evidence-based care. Now, that doesn't mean that 98% is ineffective, because some of that 98% will be effective, because sometimes just having someone to connect to is effective. But we don't know that they're getting that kind of level of care. We don't know what impact it's having because 98% of kids, we estimate, are not getting evidence-based treatment. If they have depression, most of them are getting at a young age play therapy, which is enjoyable and fun and as important a part of our children's lives as play is. There's no evidence that play therapy treats depression or anxiety. And many families who have kids with oppositional defiant problems and conduct problems, their kids are getting play as well. No evidence that that helps there. But we do have about 450 evidence-based therapies, and we need to be using those for the kinds of problems that we see. So briefly, what determines our health and what determines our mental health? What we believe now is that good doctors in hospitals and access to those doctors, and even understanding what is going wrong with your health and having good health literacy and having good insurance, that only accounts for about 20% of our good health outcomes. About 30% is genetics, what we're born with. And we're getting pretty good. We're moving in the right direction at identifying risk factors amongst genes and then screening those people who have those high-risk genes more carefully, like the BRCA genes, for example. And then we can preserve life. We can give people more years and more good years if we do that. But the other half is all socioeconomic. It's economic stability. It's what your community looks like. It's what your school is like. It's how safe your neighborhood is. It's your zip code, basically. The food you eat, the water you drink. And that's something we can do a lot about. We can really address this 50%. And that's where I think we've really failed as a field, and particularly amongst mental health practitioners. We've worked one-on-one. What would a health promotion, disease prevention strategy look like? How would it be different? Well, what is public health? Well, this smart guy, Winslow, in 1920 said that that public health is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of societies, organizations, public and private communities, and individuals. And what he basically meant was up at the top here, the tertiary, that's where most of our healthcare is delivered. That's where most of our health dollars go, treating people. About half of our dollars treat the last 6 months of life. But even before that, most of our money goes into treating an illness once it occurs. Secondary prevention addresses more people, so the triangle is wider. And that involves early identification and treatment. And there's a whole lot more we can do in mental health about that. But primary prevention, which affects everybody, is essentially that health promotion and disease prevention. It's promoting good health and preventing, thereby, bad things from happening. Why haven't we done more of this? Doctors, psychologists, social workers, by and large, aren't trained to do it. Our work has historically been based on theories that emphasized one-on-one treatment. There's been resistance to health promotion and disease prevention by parents, third-party payers like insurers, and patients themselves. We haven't known which strategies work, and most of the strategies that have been tried and advertised and supported by governments have not worked. And you know these strategies well. These are things like DARE, which in most of DARE's iterations not only don't work, but make things worse. Scared Straight, which virtually always makes things worse. Zero tolerance policies, which virtually always make things worse. Even how we teach sex education and driving in schools has very commonly worsened and not bettered things. So we haven't studied our interventions well and known which ones to put forth. So which practices are effective? This is where I want to live with you right now for the next 20 minutes and focus. So here's what works. And I've broken this into strong data, some data, and the big picture. The big picture is things like poverty, the adverse childhood experiences, higher drinking ages, graduated driver's licensing, after-school programming, all great stuff that I'm not going to talk about today because we're still working out exactly how to address that. And none of us as individuals or as clinics is going to be able to take those on by ourselves. Some areas with some data have yet to be further fleshed out as well. Things like engaging kids in apprenticeships, bullying prevention, managing homework quantity, and so forth, media literacy. But the things on your left, strong data, these are incredible. And each of these has a major impact on primary or secondary prevention of mental illness. Authoritative parenting, enhanced supervision, managing screens, managing good health, good healthy habits, school start times, teaching CBT, we'll talk about that, making condoms available, targeting drug education, and school-based mental health. Those last two are secondary prevention. Everything else is primary prevention. Let's whip through some of these things now. We've known since 1966 that authoritative parenting is best. And authoritative parenting is loving and kind and directive, and when necessary, has consequences for kids' actions. We contrast that with authoritarian parenting, which is why? Because I said so. Permissive parenting, which is you kind of do whatever you want. I'm indulgent. I'm not really watching. And the worst, which is negligent parenting, which is, I don't really care anyway, so I'm not paying attention. Children raised in authoritative homes become adolescents who have better grades, less anxiety and depression, higher self-esteem, more social competence, more self-reliance, and lower rates of all the antisocial behaviors we worry about. To boot, they also have better health outcomes as they age. They have slowed growth of their brain's threat perception center, and they have less demanding brain reward centers. The nucleus accumbens is the name of that area. But the brain doesn't hunger quite as much for impulsive treats when kids are raised in an authoritative home. And we know exactly how to raise kids in an authoritative way, and we teach that through parent management training, which is the proper treatment for kids who have oppositional, defiant, and conduct disordered behavior. It's how we teach and achieve authoritative parenting. And I'll just zip through the techniques. We could spend hours talking about each of them. And you're going to look at these and some of you will say, of course, this is true. Absolutely. We've been doing this effectively since the cavemen days. But others will look at this and say, I tried that, it didn't work. But you haven't really tried it if that's the case, because it works. And we know it works. You get many more bees with honey than vinegar, but it's not just rewards. It's really about paying attention to your kids. So positive reinforcement, effective commands, selective or active ignoring, scheduling, rewarding good behavior, limit setting with consequences, and timeouts. And notice the last two things are the negatives. The limiting, taking away, that is, and timeout, taking people away from social engagement. Those are the two punishments. We have so many more positive things we can do than negative things. And we know that spanking doesn't work. So we have lots of data on how to raise your kids in an authoritative way. And that helps our kids not only mentally and scholastically, but also physically as they age. Enhanced supervision. The more we know about, the more parents know about their children's lives, the fewer risks our kids tend to take. And the more parents communicate with their children, the more parents are seen as trustworthy. So our kids are going to get information everywhere, and they're going to get it on the net. But the more we touch base with them, the more they'll take into account what we're saying, not just what the net or their parents are saying, or their friends are saying. And we become, as this bullet point here says, we become more authoritative, and they recognize our knowledge and they come to us for support. And things like after school programs, curfews, leisure passes, a number of strategies that have been used. And I'll direct you to the Youth in Iceland program, a wonderful program where they essentially required after school activities. They gave poor families $2,500 a year to take the kids out to dinner and take them bowling and things like that. They put in a curfew of 10 p.m. on the school nights and midnight on the weeknights for kids under 16. And what they found was their smoking rate, amongst many other findings, went from the highest in Europe to the lowest in Europe. When we pay attention and supervise our kids and give them meaningful activities, they get into a lot less mischief. There's still problems, but fewer. Let's talk about screens. This is an amazing WHO statistic. Of the 7 billion people in the world, 6 billion have access to a cell phone, but only 4.5 billion have access to a working toilet. And it's not the Gucci toilet I show you here, just any toilet, even a pit in the ground. We have somehow, in some way, put more importance on social networking and the internet than we have on sanitation. There is plenty of reason To be concerned, however, my friends, 75% of youth have at least one electronic device in their bedroom, 45% have a television, a third keep it on all night long. The median number or mid number of devices that kids have in their room is 1 for kids 6 to 11, 2 for kids 12 to 14, and 3 for those over 15. Before the internet, our kids on average saw 8,000 murders and 100,000 other violent acts on television. And since the internet, huge correlations and more studies between gaming and violent thought, lack of empathy, aggressive behavior, physiologic arousal, increased blood pressure and heart rate when we engage in violent media. And this correlation is stronger than that between passive smoking and lung cancer, which itself has a low to moderate effect size. So this ain't nothing, and it's meaningful. And although screens are ubiquitous, we can no longer fool ourselves that it's okay because they're everywhere. We have to really pay attention to it. Here's a study from just last year, about 6 months ago. Pre-K children with more screen time had lower structural integrity of parts of their brain that support language and literacy and executive functioning, which is the organization and the memory parts of the brain, and lower scores on language literacy measures. So essentially, more screen time translates actually into less preparedness and even brain changes we can see around language readiness in kids. More bad news. I'm sorry to be such a negative Nancy. Screen use impacts the brain and is associated with all these things, but essentially growth of the brain in parts that matter. Decreases in gray matter, which is the anything can happen part of the brain, and reduction in thickness of the brain in areas that engage in planning and organization and decision making, and reduction in attention span and problems with memory and enhanced reward sensitivity. So they seek rewards more and they're not as sensitive to loss and signs of craving and signs of obesity. So the more screen time in all of its aspects, the more we're seeing this. Now, this contrasts, of course, with my statement earlier when I said, sometimes you just got to choose your battles. Yes. But we're talking about kids 5, 6, 7, 8 hours of screen time a day. This really does seem to be detrimental to them. And it also, not just the screens themselves and what they do, but it takes them out of other person-to-person time. We weren't built for screens. We evolved over millennia and millennia to engage with each other, to look at each other's eyes, to see what our body language is like. That's what we evolved to do, not to be on a screen. And so we're presenting ourselves with a big challenge. That doesn't mean we can't accommodate. But if we immerse wholly right away, we're going to get behind the 8 ball. And we're already seeing that now. When a cell phone is present, people report that their conversational partner has less empathy, and they report less quality and closeness from that relationship. And when we remove for a period of time, like a week, as we've seen with middle school students, we remove them from their screens for a week, they all of a sudden have better eye contact. They read body language better. They tell us that they're more empathic and more concerned about their peers. Limiting screen time also reduces obesity, and extensive screen time, this is another conversation, but may also contribute to early puberty through light exposure. So this is why I say God created the fruit bowl, so that we could postpone screens as long as possible, wait until 8th is a good organization, encouraging parents to hold off until 8th grade. And until parents come together on this, no single parent's going to be strong enough to not keep up with the Joneses and get their child a phone when the child wants a phone. So consider things like Life 360 or Find Friends on the iPhone, ways to know where your kids are at and them to know where you are at, and demand that. Remember that when they engage in social media, you want to friend them and be able to see what they're doing. They can find ways around this by coming up with aliases and different things, but you want to let them know that you're paying attention. You want to let them know that you care. In my book, Born to be Wild, I have a contract essentially that I give parents to help them present the phone when they finally do give it to their child. You own the phone essentially as the parent. You can call it the child's phone, but the parent owns the phone because no child can even purchase a phone or buy a plan under the age of 18, and they're very expensive and most kids don't have that kind of money. So we need to certainly apply our parenting here and say, this is a privilege, not a right, and you're going to get to use this. It's first work, then screens. Screens are a reward. Limitations, consider limitations on screen time, particularly when our kids are young. Television, computer games, all that. Try to keep it only for the weekends and downtime. Keep all screens when the kids are young in shared spaces. Laptops and phones have really disturbed this, and this is one reason young kids are getting into so much pornography and they're taking their clothes off for each other, because they are allowed to use these things in private in a mobile way. So try and keep all screens on desktops that are in common spaces. Bring them in the living room or dining room in order to do their homework. If kids must be on screens in their bedrooms, then keep the doors open. Stop screens at least an hour before bedtime because of blue light. And think about some of these devices here. We can go into more in Q&A if you want, but you want blue light blocking devices if your children are having sleep troubles, because blue light blocks melatonin, which starts to dribble out in the brain about 4 hours before the usual bedtime. So you need to block that somehow. When you talk to parents and you ask them what schools are for, and I do this all the time when I go to schools, I often say, what's school for? What do you want for your child by the time your child graduates high school? They typically don't say that they want their kids to be great at Shakespeare or geometry. What they say is they want their kids to accept other kinds of kids. They want their kids to be honest. They want their kids to care for others. They want them to have democratic principles in mind. But we only teach these things in school indirectly, and we're missing another huge opportunity to teach these things. I have a lot to say about resilience, but I'm going to give you just a very brief sort of overview of what those components are. Resilience as a definition is really the ability to manage and overcome the inevitable bumps in the road that we're all going to experience. And I've broken resilience. There's about 9 data-based factors that contribute to resilience, but I can capture them all and I can address them all and I can coach kids through all of them with this acronym CHARM, which essentially enhances kids' self-efficacy, improves their relationships and their emotion regulation and their coping. So this is by working on communication skills, healthy habits. I'll tell you more about each of these things as we go, but that's exercise, sleep, nutrition, organization, goal setting, stress management or anxiety, risk reduction, and mood management. And these things are teachable. And my group is continuing to engage. We've already published on this at NYU with the college students, that we can enhance their resilience by teaching them this material academically. We miss a huge opportunity. Probably none of you ever got any education in sleep. Amongst the 3,000 universities and colleges in our country, only 100 offer a college course on sleep. If you took AP psychology, maybe you got an hour on sleep. When I was in medical school in the 90s, I got a single hour on sleep. Sleep is where we spend a third of our lives. Sleep has impact on everything that happens during the day, on how we learn, how we grow, how we relate, how we manage our mood, our anxiety, how we exercise, how we do or do not gain weight. Sleep is vital, and understanding sleep is important. Things like that are so simple. We need to be teaching these things in school. So we know that breathing and progressive muscle relaxation and very simple things like mindful meditation actually reduces distress. And in San Francisco, not far from you, the 5 fight schools in the Mission, when they incorporated a 30-minute breathing program, 15 minutes in the morning, 15 minutes in the afternoon, they saw huge reductions in bad behavior and major improvements in GPA. Cognitive behavior therapy skills are also eminently teachable, and we teach those to manage mood and anxiety. And my 1-semester course that taught these skills, once the semester was over, and then even a semester later after the students were no longer in the course, showed that our kids had big changes. These were freshmen through seniors in college. They had big changes, big effect sizes in their dysfunctional or negative attitudes about themselves and the world, in the degree of stress they perceived, and their coping skills. And other studies we've done on sleep have shown that teaching students about sleep results not only in better sleep and a more rapid time to fall asleep at night, but also less anxiety and mood, even 3 months later after they've learned to sleep better, because sleep is so important. So back to this triumvirate of good health, right? We need better nutrition, we need better exercise programming, and we need later school start times. And it really couldn't get much easier. If you look over the past 50 years, what you see is a huge increase in obesity and overweight. About 35% of children, about 45% of adults are now overweight or obese in our country, and that's 85th percentile to 95th for overweight and 95th and up for obese, and it's about half and half in children. And these are just enormous numbers, and it's not equitable racially. You can see here that whites, less than blacks, less than Mexican American Latinos, have disparities in how much weight we put on, and much of this has to do with the kind of food that's available, the kind of stores that are selling the food, the lack of fresh food, the parents who are working 2 jobs and not able to cook a healthy meal. This is just a New York City school lunch menu, which costs about $1.50 a day per kid. You can opt into this if you are financially strapped, and that's how most people take this lunch. This is not a lunch that most kids who have money buy, but you can see that just about everything here is, the salad bar is a standard menu, but everything else is unhealthy. And this is just classic. 20 million kids in America get a free lunch. We used to make those lunches on site, fresh. And now what happens is those meals are made in industrial kitchens, packed in plastic, where they're then microwaved at the school, where PCBs and phthalates and other things that can be hormone disruptors get into our kids' bloodstream and can even contribute to early puberty, which has lots of problems. But in Berkeley, just across the water from you, when they taught elementary school kids about nutrition and gardening and cooking, those kids were twice as likely to make better food choices for the following year. So there is hope, and teaching kids about food is one of the things that we could be doing. Now, exercise, Center for Disease Control says kids should get 60 minutes of aerobic exercise a day. Sports and fitness industry says less, at least 25 minutes 3 times a week. But only about 22% of kids 6 to 19 get 60 minutes or more 5 times a week. 27% of high school students get 60 minutes 7 times a week. And 51% of high school students attend any PE, and only 30% attend daily. So we're really failing here. And exercise is so important because we know it supports learning and cognitive development, the brain. We know it improves social and emotional functioning from having opportunities to practice behaviorally, and also having just the brain being ready and engaged with others. And we know, and this is really remarkable, that exercise, to the degree described in the former slide, reduces mild and moderate depression, treats it as well as psychotherapy or medication. Not severe depression, but mild and moderate depression, where a lot of our kids live a lot of the time. So exercise is something we've taken away from our kids. When I was a kid, and probably when many of you were kids, you had exercise 5 days a week. You had a recess. You had a long recess after lunch. You may have had an afternoon recess in elementary school. You had PE every day in middle school, and you had gym 4 to 5 times a week, and maybe an extracurricular in high school. So many of our schools no longer have that. And if you look at sleep, I mentioned that already, but this is just a wonderful pediatric study looking at how over the last 100 years, not only has our amount of sleep shrunk by about 80 minutes, but so has what's been recommended by pediatricians to families based upon all the distractions, all the electric devices that now keep us awake, all the lights, all the music. But when we give our kids even 1 more hour of sleep a day, we have improved emotional functioning. We have better memory, better attention, better math, and we have better behavior, even when teachers are blinded. They don't even know which kids are sleeping more. So parents and teachers report much better outcomes when our kids get more sleep. And when they get less sleep, these things worsen. And this is just a simple study of adult brains, but you deprive an adult brain of 35 hours of sleep, just as an example, which many of us, myself included, do regularly when I was training in medicine and as a resident. Your brain doesn't work as well. You just simply don't have as much activity going on in your brain. Later school start times, by contrast, 20 years, we've known better grades, better SAT scores, less tardiness, fewer absences, a big reduction in motor vehicle accidents, less caffeine use, better decision-making, reduced amygdala, again, threat hub of the brain activity. And this slide is just to remind me to tell you that when we don't sleep, many of us think we're doing okay because we can still talk and make decisions. But we're only kind of good at single brain areas when we don't sleep. So if you ask me to multiply times 5 memory, and if I've not slept for 3 hours, I can tell you, I might get to a little more slowly, but I can tell you 40. But if you give me a word problem where you say, so 8 boys took a 5-mile walk each. How many miles did they walk in total? That now relies on lots of different parts of my brain. That relies that I hear the problem. That relies on me being able to then use my auditory cortex, my decision-making, planning prefrontal cortex, my mathematical part of the brain. And that requires multifactorial parts of the brain to engage in. And we often make a mistake there, even though the answer is the same, 8 times 5. And who has trouble with decision making, and who stays up late, and who doesn't get enough sleep because our kids are sleep deprived, and who's behind the wheel of a car at 10 o'clock coming home from their job at Burger King or coming home from the library or football practice, who is exhausted making those decisions every moment on the road and in their life and relationships and around school and college applications and all the rest. It's our adolescents. So I know I'm running towards the end of my time, but I beg of you just a few more minutes as I quickly get through the last couple of points. Abstinence-only education doesn't work. 30% of high school girls drop out, most often due to pregnancy. And in the United States, 51% of Latina teens get pregnant. This is a big issue. Dropping out of school results in every bad outcome that we don't want to see. Academic outcomes, health outcomes, drug outcomes, more poverty, which makes everything worse. So Teaching kids about contraception does not increase the likelihood that they will have sex. Not only that, providing condoms to kids does not increase them having sex. I know there are so many cultural boundaries to this. I know that there are religious prescriptions and concerns around this. I know that the history of our country is highly puritanical. At the same time, studies from the US and Canada and New Zealand and Australia and all over Western Europe have shown that having condoms in schools does not increase the likelihood that our kids will have sex. It only increases the likelihood that if they are having sex, they will use a condom. Not getting pregnant in high school is a big deal. Getting pregnant in high school changes your life. Drug education. So targeting kids for drug education, all of them, like DARE, hasn't been very effective. But targeting kids at high risk for mental illness and substance use has been effective. Not hugely effective, but it has reduced the risk by a third or so for up to 2 years in many studies. And there's a herd effect. When the cool kids stop using drugs, the other kids follow along and they stop using drugs. So we need to pay attention to that. Remember that most of our public schools in the United States don't have comprehensive health services, and that kids with illness, mental illness, are more likely to drop out of school, get incarcerated, drive drunk, attempt suicide, what have you. Even only having ADHD results in many more risks around substance use, health problems, motor vehicle accidents, holding a job, and so forth. Where we have school-based health clinics, our kids are more likely to get care. About 10 to 15% of children in the US get any mental health care service. It's about 7 million kids. And most of these kids get those services at school. And if there's follow-up at school, more than 90% will get follow-up care. But if we refer them from the school or from a clinic out into the community, then only under 15% will get follow-up care. And that's a big concern. So we really need to be putting these programs in schools, making ourselves available. I don't know if Caminar, for example, has clinics in schools, but that's a huge and important place to see our kids and to help them maintain their care. And the research shows that these programs are not only effective for the kids who are having difficulties, but also for other kids around them because they become more empathic and more understanding. There's much more we can do. Things we have to study better: apprenticeships, community service, bullying prevention, reducing the quantity of homework, evidence-based mentorship programs. And the next steps are really, this is just a summary of what we can do. We can teach parent training in schools. We can teach our parents who have kids about parent training, particularly those parents with mental illness. We can work to enhance after-school programming and support our kids in staying busy and engaged. We can limit phones in schools, help parents to establish rules at home. We can teach resilience in schools. We can call it neuroscience. Everybody loves the term neuroscience. So all this stuff I'm talking about, sleep and nutrition and exercise and the home ec skills and how the brain works and risk management and anxiety management and breathing and mindfulness, all of that is neuroscience. We can teach resilience to our patients. I do a lot of resilience work with my patients. We can teach nutrition. We can work to enhance physical education. We can support later school start times, which make a big difference, provide condoms in schools, targeted drug education, and enhance after-school based clinics. And with that, I thank you very much for allowing me to go through this. I know I moved quickly. You've got the slides, and the show, I'm sure, is being taped. And I thank you very much for inviting me. I'm thrilled to be involved with you.
Check. Thank you, Jess, for the thorough and enlightening presentation on the immediate and long-term risks our youth and adolescents face and what we can do to assist them. We now want to turn to questions that have come up during the presentation. The first question I want to put to you, Jess, is any advice about managing screens for kids when they're in a digital school where there are no textbooks and all of it occurs on an iPad?
I think this is a big concern. I empathize with this one because our schools are now sometimes demanding iPads or laptops. And so it makes sense environmentally in a way because we're not chopping down so many trees, but there's also something about holding a book. We all know there is the smell of the book, the way it feels, looking at the words, you can cozy up with it. So I'm sorry that some schools have gotten completely away from that. I certainly understand a mixing or a melding. My answer would be that we need to limit screens. So if they need them for school, they need them for school. And then we want to use other time not for screens so that those kids, unfortunately, may get a little less recreational screen time if we want to do right by them.
Okay, the next question is, what if a parent is doing all the things that you described in terms of building resilience, nutrition, sleep, positive mental health support? What do they do if their child continues to have difficulties where the kind of preventive remedies are not sufficing?
They call Caminar and they say, I need help. And they say, listen, I'm doing, I think, everything right. And I need some support. I need some help. We have to be fearless about asking for help. You know, it really is true that it takes a village to raise a kid. And we are not born parenting experts. I became a child psychiatrist after I already had a child. And I really struggled those first few years before I understood a lot of how development works and a lot of the things that we can do to help manage our kids' behaviors. Because a typical kid has lots of struggles and challenges. The good news is that most of us did okay and most of us raise our kids okay. But the fact is that there are lots of things to learn and lots of support that we need. And sometimes just calling you guys and getting some family counseling or some parent management training. And sometimes our kids have more than we can manage because they do have a psychiatric or psychological disturbance and they need help with that, or a learning problem. And that's okay too. We just got to get the help.
I know we have more questions, but we're running out of time. We appreciate your active engagement. So I want to thank you and all of your time and participation today. Again, a special thanks to Jess for the amazing and enlightening presentation he gave us. As I alluded to earlier, we're already seeing an influx of new clients. And as I mentioned in my opening remarks, people typically become most symptomatic around a year after the epidemic as life returns to normal, but their symptoms remain embedded in their minds and bodies as they transition into their next phase of adaptation. Most importantly, we need your help to meet the current demand for mental health services and to minimize what could be lifelong mental health and substance use issues. As a community, the time to act is now. Recently, some of our funding partners, like the Silicon Valley Community Foundation, have designated special funds to help us meet the increased demand. If you found this program today valuable, we invite you to support us with a donation by visiting our website, www.caminar.org/donate. Thank you for your time, your generosity, and your compassion. We feel your love, and we simply cannot continue this important work without you. Be kind to yourselves, stay healthy, and please let us know if you have other questions or would like to learn more about our work. Have a great afternoon. Thank you.